Hi there. I'm going to be giving you some education on your new medication, digoxin. So you're going to be taking this for your heart failure. Some other reasons you can take this medication is for atrial fibrillation or flutter, um, paroxysmal atrial tachycardia, and then the heart failure, which is why you're taking it. So this drug works by it makes calcium more available for contractile proteins, which pretty much just increases your cardiac output, and it's going to increase the force of contraction, which will ultimately just decrease your heart rate. And that's what we're looking for. So for you, the dosage is going to be 125 micrograms. It's going to be in pill form, so you're going to take it by mouth, and it'll just be once daily. So preferably at the same time each day, in the morning would be best. So some food and drug interactions that you're going to want to watch out for is amyloride, cholesterol, metoclopramide, certain thyroid hormones. These all decrease digoxin levels, and then amiodarone, diltiazem, indomethacin. These all will increase the digoxin levels. So some other ones, some common ones are antacids. This will decrease the absorption, so it'll make it less effective. And then anticholinergics will increase digoxin blood levels, which will make it more increase your risk for toxicity. And then flaxseed and high fiber foods will decrease the effect. So it'll just make the absorption slower, and it'll decrease the effect of the medication. So you just want to consult the doctor if you're going to be starting any sort of new medications or taking anything over the counter, as this medication can have lots of side effects with or interactions with lots of medications. So some side effects for this medication. These are all normal. No need to report them unless it's like a bothersome issue and you want to get on a new medication because of it. But so headaches, drowsiness, confusion, fatigue, depression, apathy, blurred vision, just some GI stuff, nausea, vomiting, diarrhea, abdominal pain, and then diplopia, which is like double vision. So if you, these are expected side effects, so if you get any of these, you can let us know, but it's nothing too concerning. Some adverse effects, which are the more concerning ones, is going to be dysrhythmias. So if you feel palpitations, or if you go to the doctor and we notice they have a dysrhythmia, AV block, and hallucinations are some adverse effects. You're going to want to notify the healthcare provider if you have loss of appetite, lower abdominal pain, diarrhea, weakness, drowsiness, headache, blurred or yellow-green vision, or a rash. Those are going to be the signs for you to notify the provider. And then a couple more is like depression, shortness of breath. Obviously, if you're starting to have allergic reaction, you'd want to go to the emergency room. Weight gain, so like swelling, persistent cough, and you also want to notify if doses are missed for more than 2 days or more. And then if you are planning on becoming pregnant, or if you're breastfeeding, you're also going to want to notify the doctor. And then some special considerations while taking this medication is take precautions if pregnant, geriatric, renal disease, acute heart attack, AV block, hypertension. You want to separate the ingestion of flaxseed and high fiber foods by at least 1 hour of taking this medication. So that'll just allow for absorption to be better, and for the flaxseed and high fiber foods not to affect digoxin absorption. And then you'll be on a sodium restricted diet most likely, and then probably prescribed potassium supplements to prevent toxicity. And then you want to take it the same time each day, like I said. And then if you do miss a dose, you want to make sure you take it within 12 hours. and you're not doubling doses. And then another good idea is to wear an emergency ID band to describe the dosage and the reason that you're on digoxin, which would be heart failure in this case. And then some outcomes that we're looking for is the decreased heart rate mainly, and decreased dysrhythmias if you are having any of that. Okay. And then if you don't have any questions, here's this. And now I'll be talking about what to monitor as the nurse. So I won't be giving this medication if their pulse is less than 60. I'd monitor electrolytes. We'll assess apical pulse for 1 minute before administration. Strict I's and O's, and daily while they're in the hospital, so they're not retaining fluid. And then to go along with that, monitor their daily weight. And then you monitor renal studies, so BUN and creatinine. And then also liver function tests, ALT, AST, bilirubin, and hematocrit. And then we also want to assess for if they're taking other over-the-counter medications or herbal supplements, and then monitor their ECG for any cardiac changes. Thank you.